Your lungs sound nice and clear. Just going to move around this way to the front here and lower your gown.
Okay, we're looking at the anterior aspect of the chest. We'll examine the anteroposterior diameter of the chest, the slope of the ribs, the color of the skin. What else?
Well, I don't see any evidence of a barrel chest or any chest abnormalities. I also want to check the intercostal spaces.
And what are we looking for?
Bulges, retractions, use of accessory muscles.
Now, Mr. Shepard, just breathe normally for a moment. And Anna, you want to note the quality and pattern of respirations. And what do I mean by that?
Rate, depth, and rhythm.
Exactly.
Okay. So now I just want to check the chest for tenderness and sensation.
Mm-hmm. Of course, at the same time, you'll be assessing for lesions, masses, and fremitus.
Okay. All right. So let me check for fremitus. Just say 99.
99.
Okay. Good.
Okay. Now you want to percuss for tone at the apices of the clavicle and then again at the intercostal spaces, comparing sides.
Okay. So now I want to auscultate for anterior chest sounds and adventitious sounds.
Mm-hmm.
Deep breath. Again. Again. Okay, sounds clear.
How do we assess skin turgor?
Well, I pinch the skin under the clavicle. Is that okay with you?
Sure.
Okay. All right. And I just want to make sure that it returns to its original shape. And the last thing I want to do is palpate the breast tissue and the axillae.
Mm-hmm. Well done.
Thank you. Okay, so I'm going to get you to lie back here. And we're going to assess your heart now.
What do we do first, Anna?
Oh, well, we check for visible pulsations, and then palpation of pulsations and the apical impulse.
Right. Use the palmar surface of your hand in the apical or mitral area. Once you've found the pulse, use 1 or 2 finger pads for an accurate palpation.
Got it. Now palpate the apex. The left sternal border. And the base of the heart for any abnormal pulsations.
Mm-hmm. No abnormal pulsations or vibrations?
No.
Then let's move to auscultate over the apex to listen to the apical impulse. What are we assessing?
Heart rate and rhythm, and I use the diaphragm, right?
Yes. Now what do we do if it's irregular?
Then I would auscultate for a pulse rate deficit.
Right. Then we auscultate the aortic area, the pulmonic area for S2, Erb's point for murmurs, the tricuspid area, and the mitral area for S1.
Let me make sure I have this right. S1 is the lub of the cardiac cycle, and S2 is the dub of the cardiac cycle.
That's right. And the extra heart sounds are S3 and S4.
Okay, so we're going to get you to sit up. I want to check for S3 and S4. We got to lower the table. Pull this out.
Okay.
Put your legs up there. I'm going to slide your arms out of the gown. I'm going to get a drape here. Okay, let's get you to lie back.
Okay.
Okay. Now I want you to turn on your left side for me.
All right. How's that?
You all right?
Yes, is that okay?
Okay.
Okay, Anna. You'll use the bell of the stethoscope to listen to the apex of the heart.
Okay. Okay, nothing abnormal there.
All right, time for the abdomen.
Okay, so just turn on your back now.
Okay.
And just drop your arms to the side.
All right.
That's good.
Now, what are we looking for?
Just visible pulsations and overall skin color, striae, vascularity, lesions, rashes, masses, scars.
Distension?
Distension, yes.
How do things look?
The skin is a little bit more pale, but nothing abnormal.
Okay, be sure to note also the location, contour, and color of the umbilicus.
Okay. The skin looks the same as the surrounding skin, and the umbilicus is midline.
Okay. Now you want to note the symmetry and the contour of the abdomen. The abdomen is flat and evenly rounded, right?
Mm-hmm.
Okay. And lastly, there are no aortic pulsations or peristaltic waves visible?
No.
Okay.
So, what I don't understand is why is the sequence different with the abdomen?
You mean why do we auscultate after we inspect?
Mm-hmm.
This is so you don't alter the pattern of bowel sounds.
Oh, right. Okay.
Okay. So when we auscultate, we're actually assessing for bowel sounds. Like what?
Frequency, intensity, pitch.
Right. You should hear some soft clicks and gurgles at about 5 to 30 a minute.
Okay.
Then we move on to vascular sounds like a bruit.
Okay. So I auscultate the aorta.
You want to use the bell for that, Anna.
Oh, right. Okay. So I auscultate the aorta. Now the renal arteries, the iliac arteries. So now I'll check the femoral arteries. We'll slide this under here a little bit, okay?
Mm-hmm.
Okay, no abnormal sounds.
Very good.
Did I get all of them?
Yes, you did.
Oh, great.
What's next?
I need to percuss for tone.
Okay, now make sure you cover all 4 quadrants.
Okay, so normally I would expect tympany over the stomach, and when I get to the more solid organs, it's a little more dull, right?
Right.
Okay.
Okay. Now lightly palpate the abdomen in all 4 quadrants.
Okay.
And why do you think we do this, Anna?
Just want to check for muscular resistance, any enlarged organs, masses, tenderness. Any tenderness or anything there?
No.
It especially helps us detect an enlarged liver or spleen.
Okay. Oh, that feels okay?
It's fine.
All right. That's good. Okay, so now we're going to move on to the lower extremity.